Hi, Dr. Pelto here. I'm going to go over this question that a patient asked me. She came in the other day, and you can see what we're looking at is this black crust here at the side of the nail. Is this black around the edge of my nail normal after an ingrown toenail procedure? She had specifically a matrixectomy. This is a very common procedure. Let me explain. There are two main procedures we do for ingrown toenails. I guess there's three. If you have an ingrown toenail, you can simply just trim out the edge. That doesn't need any anesthesia. You can numb up the toe. Normally we numb it down here with two little pokes, one on each side. And then I can take out a little sliver of nail like I did right here. And then if it continues to come back multiple times, that's where I'll take a chemical and I'll put it underneath the nail right about here. And I'll use a Q-tip to put it underneath there. And we use in our office 10% sodium hydroxide. There's also, because someone asked what you use, I do 10% sodium hydroxide for 30 seconds. You can also use 89% phenol for a minute. We used to use phenol. The reason we stopped is because phenol, ours expired. It expires a lot quicker than sodium hydroxide. So that's why we use sodium hydroxide. And it's going to cause a chemical burn where the nail grows back. So our hopes are the nail will not grow back. There is a small portion, maybe 1%, that has a nail that grows back. I think the reason is I don't do a good job at cleaning all the nail out. Once I pull out the nail, there might be a piece of nail in there or it might be a piece of skin that doesn't allow that chemical to get on the skin cells, or the chemical could be old. I guess that's another reason that could cause it. And in this specific case, this is a 2-week follow-up for a patient, and all this black stuff right here, this is normal. This is a scab, or we call an eschar, which is a scab around the side of the nail, and this can be cleared out. There's tends to be some red tissue, which is beefy, healthy tissue. We call it beefy. I don't know why, because it looks like beef. I get ground beef, and we clean that out. And it takes about 4 to 6 weeks for this nail to heal in the edge. There will be a scab, and then the nail will not grow back. What are the two risk factors? One risk factor is an infection that can happen. If you notice redness going up your foot, that is an infection. If you notice redness, swelling, the skin sloughing off, all that is normal because of the chemical reaction in the skin. So you should see your doctor if you're being treated. And then the other thing that can happen, you can get a little kind of weird little piece of nail that can grow back. It can either be a piece or the whole nail. That's either called a spicule or a recurrence of the nail of the ingrown toenail that can be treated again and retreated. If you found this helpful, I do have an ingrown toenail course, which is anything and everything that you want to know about ingrown toenails. I put a little link to that course on my website, Dr. Pelto. If you like this channel, please subscribe, put a little comment underneath it. If you have a different question, something I didn't answer or something that's obvious that I didn't know, I'd love to do another video to answer any of your questions that you put in here. And I'll also put a couple of other videos that might be helpful for you if you're trying to work on your foot conditions. Okay, guys, thank you. Hope you enjoyed this video.